Heartburn affects millions. For decades, finding relief has meant simply walking up to a pharmacy counter. One common treatment is cimetidine, a highly effective medication designed to treat GERD and peptic ulcers. Because these boxes sit right in the aisles, people assume they are entirely safe. We tend to think that a drug bought without a prescription goes straight to the stomach, fixes the acid, and disappears without touching anything else. But human biology doesn't work that way. When we swallow a systemic chemical to fix a highly localized stomach problem, that chemical travels everywhere. Looking at the stomach cross-section of this anatomical illustration, we see exactly how cimetidine operates on its intended target. Inside the stomach wall are parietal cells, microscopic biological pumps responsible for secreting the harsh stomach acid needed for digestion. Cimetidine acts as an H2 receptor antagonist. An H2 receptor antagonist is a class of drugs that binds to specific histamine receptors on the stomach lining to block the production of acid. By binding to these cells, the medication effectively shuts down the pumps. While it works exceptionally well for the stomach lining, the drug doesn't stay there. It absorbs directly into the bloodstream, circulating to other biological systems. As cimetidine leaves the digestive tract, it travels through the blood and encounters the endocrine system. Looking at the bottom left of this graphic, we see one of the first major unintended consequences: gynecomastia. Gynecomastia is the abnormal enlargement of male breast tissue. This happens because cimetidine physically inhibits the body's ability to metabolize estradiol, which leaves an excess of estrogen circulating in the bloodstream. At the same time, the drug acts as a blockade. It prevents dihydrotestosterone from successfully binding to its proper cellular receptors. By simultaneously increasing estrogen and blocking testosterone, this chemical interference disrupts the delicate balance of hormones, showing just how promiscuous this molecule really is. From the endocrine system, the drug carries the drug into the body's primary chemical filtration plant, the liver. The liver relies on the cytochrome P450, or CYP450, enzyme system. This superfamily of enzymes is responsible for the metabolism and clearance of foreign chemicals and drugs. Think of it as a continuous metabolic highway clearing out waste. This highway is critical for patients taking warfarin, a potent, widely prescribed blood thinner used to prevent strokes. Warfarin has a highly dangerous narrow therapeutic index. A narrow therapeutic index means there is only a tiny margin between a safe dose and a dangerous one. If the dose is slightly too low, the patient can develop deadly blood clots, and if it's slightly too high, they can experience severe internal bleeding. Because of this tight margin, warfarin's safe passage through the body relies entirely on a fully functioning CYP450 system to constantly and predictably clear it from the bloodstream. Returning to our anatomical chart, the upper right section reveals cimetidine's hidden identity in the liver. It operates as a broad-spectrum P450 inhibitor. The drug binds directly to multiple CYP450 isoforms, specifically CYP2C9, CYP1A2, and CYP3A4. By occupying these enzymes, cimetidine shuts down the liver's ability to clear other drugs. Consider a patient who is carefully stabilized on a daily dose of warfarin. One evening, they experience a sudden bout of heartburn and take an over-the-counter dose of cimetidine. This data table outlines the direct mathematical consequence of that decision. Cimetidine reduces warfarin clearance by 20 to 50%. Without the liver enzymes to break it down, the blood thinner rapidly accumulates to toxic levels. As the clearance drops, the patient's INR abnormally prolongs. INR, or International Normalized Ratio, is a standardized blood test that measures exactly how long it takes for a person's blood to clot. This molecular traffic jam places the patient at immediate extreme risk for a major life-threatening internal hemorrhage. An unmonitored attempt to cure simple heartburn inadvertently turns a life-saving cardiovascular medication into a deadly toxin. This full graphic maps out the entire biological domino effect. A pill swallowed to reduce acid in the stomach travels outward, altering hormones in the endocrine system and suffocating enzyme pathways in the liver. The true danger exposed by this drug is the illusion of isolation. The easy accessibility of over-the-counter medications creates a blind spot, allowing patients to bypass doctor oversight. Looking at the bottom right corner, the clinical management strategy for this specific interaction is clear. Patients on blood thinners must either drastically reduce their warfarin doses or switch to alternative H2 blockers that don't inhibit the liver. It highlights a strict rule of modern pharmacology. No chemical, no matter how common or easily purchased, acts in true isolation within the human body. Always verify molecular compatibility with a medical professional before introducing any new variable into a complex biological system.